is No Gifts Please, the parenting podcast by the pair with no real gifts, but a whole lot of gumption. Hey everyone, I'm Steve Noviello.
And I'm Jenny Anchondo.
It's always lovely to see you.
You too.
You know, we often talk on the show about how this is our kind of, secret way of getting information that we need. We are entering the world of orthodontics in our home.
This shocks me so much. Because I feel like when I think of you as a parent, you lean more, Heath, kind of like old school, kind of like kids don't need braces until they're 16 and have a massive snaggle tooth. And then when I was like, wow, the modern man. I mean, you're a modern man, but just like the early orthodontic stuff, I'm just so thoroughly impressed.
I remember my journey as a child, like 7th grade was when kids got braces.
Yeah.
There are children, my son our oldest is in 3rd grade. There are children who have had braces and have them off.
No, I know you're not like the first,
I'm like, but
you're
you
still...
don't even have all of your teeth yet. How are we doing that?
That's why we brought in an expert, because we were like so confused by this. And I feel like I'm behind. And so when I'm behind, I bring somebody in to interview to tell me exactly what to do. So today we have Dr. Kirit Sodhi, who is actually an airway-focused smile architect. Now, she's the co-founder of Define Orthodontics here in the Metroplex. So she combines advanced clinical expertise, cutting-edge tech, and a deeply patient-centered philosophy to create beautiful smiles. And then these more like healthy, confident lives. It's the teeth, it's the face, it's the bone, it's like long-term what you're going to look like. There's all this stuff. Okay, Dr. Sodhi, so glad you could come in and answer all of our questions because I am perplexed and excited.
So is it our imagination? Is this happening younger now for kids?
It's not your imagination. Thank you so much for having me, first of all.
Of course.
It's not your imagination. I feel like orthodontics is a very evolving subject. Like things have been changing a lot for many, many years. Like it used to be. So even when I got trained as an orthodontist, so I was a dentist first and went to the orthodontic residency for 3.5 years. And when I was in residency, even I was taught that, okay, we've always done phases of treatment. So 2-phase treatment, phase 1 when the kids are still younger, and phase 2 treatment when all the adult teeth come in. And usually phase 1 treatments were reserved for kids who had like really severe kind of skeletal issues going on.
Like overbite, crossbite, that kind of thing?
Correct.
Okay.
If you had a crossbite, yes, we need to treat that as early as possible. And headgears were there. People would use headgears during the growing periods of the kid, when the kids are still growing. And then braces were reserved for, when you have all your adult teeth, that's when we're going to get braces. Okay. But what has happened is more and more research and more things have kind of lead to like, okay, let's, the whole system has changed from more of a let's be more preventative, so that's the model that we're going for. We're doing more research on why are the issues happening, why are we waiting for these kids to grow up and get all that snaggle tooth and have a mouthful of, crowded teeth
right?
And crooked teeth. And then when it's like, oh yeah, now you're ready because all the teeth are in all weird sort of places and now we're going to put braces on. And yeah, you know what? We may have to take 4 teeth out because you don't have enough space there. And we're changing all this thing. So now the mode has changed where we're focusing more on preventative side. Like, okay, what can we do early on to prevent the teeth from going to that spot?
Nobody has to have an awkward phase anymore.
Well, I mean, to your point, I mean, it does. Like I remember when I was a kid, I got braces. And it was kind of you rolled the dice, you waited to see what God gave you when everything came in, and then you corrected as much as you could. Whereas now our 8-year-old, he's got some nice space and whatnot. He's got a bit of a crossbite. So now it seems like in a preventative way, while the palate is still not fused together and we can still move stuff around, why don't we treat him to set him up for success for when his teeth do come in? And now maybe phase 2 won't be as severe as it might have been had we waited. Is that
Absolutely. That is essentially the whole gist of it is this. Yes. There's also a segment or a thing of like, airway things come in where we're like looking at the overall health of a child. There, in recent years, there have been a lot of studies and, research has gone into sleep apnea and how adults are developing sleep apnea with smaller, reduced jaws and stuff. And people are getting into CPAPs and machines very early on in their lives. And people have started to look into, okay, where is it all stemming from? Let's talk about pediatric sleep apnea. Like, why are kids getting not good sleep? So sleep has been a big topic where people have started to realize the importance of a good, healthy sleep. If the child is not sleeping properly at night, they are kind of tossing and turning and waking up in the middle of the night too much, then they're not getting that good growth hormone. All of that growth and development is not happening properly. And sometimes the kids are wrongly diagnosed for ADD and ADHD, and the poor child just did not have a good sleep at night. So that's why it could be a reason. Like, it could be, they couldn't sleep at night properly. And that's why now during the day, they're just like, so everybody reacts to lack of sleep very differently. Sometimes some people become hyperactive, they will become very hyper. So instead of like being sleepy, they're being hyper and they're just tossing and not paying attention to things around because their mind wants to rest. All they need is a restful sleep.
Oh,
but
wow.
Looking back at it, okay, it's a multifactorial thing. There's a lot of things that are needed for good sleep. One of the factors is our lips should be together. We should be having a good flow of oxygen from our nose. Now, that's where orthodontics come in partly, because if your tongue doesn't have enough space and you're mouth breathing and you're, kind of hanging the jaw down, you're not sleeping properly, you're not getting into the deep REM cycle.
That's exactly what's happening at our house.
And it's so funny because you would never think, gosh, she's really cranky. I should probably go see my orthodontist.
Right.
Like,
No, exactly. Exactly.
Right?
Well, and so what it's interesting because, and I don't know if any parents listening have experienced this, where it's like, okay, so there's an allergy situation, right? So you're thinking, okay, so they're mouth breathing because they can't breathe through their nose because there's an allergy situation. So then you start these allergy shots, which take 10 million years. They are once a month till the end of time. So then you think, okay, we got that worked out. Wait, but now is there an adenoid issue? Or is there something else blocking it? Or is it there's not enough space in their mouth? So then you're sort of figuring out, which thing is it? Do we need to expand their mouth? So where do you come into play? Somebody comes in, they're like, okay, my child is, I look at them on the baby monitor, because if you're really crazy, you have a baby monitor on your 8-year-old if you're a complete psychopath. So I can see her mouth open, right? And then I'm like, okay, it's not the allergies anymore. Like her nose, we've been doing the sprays, like she can breathe through her nose, but her mouth's still open. So then somebody comes to you. What do you do next?
So this is a very holistic approach. This is exactly what we need. It's a multidisciplinary thing. It's not just my ENT is going to solve my issues or my myofunctional therapist is going to solve my issues. You have to, whatever you're doing is absolutely right, but you kind of have to go down the list. We start with that. We need to make sure that our passages are open,
Okay.
The funnels are open. If I'm asking you to breathe from nose, is a child able to breathe from the nose? If they have allergies or if the adenoids and tonsils are super enlarged, they won't get that airflow. The upper airflow is restricted. So in that situation, the ENT consultation is needed. You need to get all of that resolved first. And then let's talk about, okay, what's next? Now, what's the next step is? Oh yeah, the mouth is really narrow. The jaw's narrow. The tongue, there could be tongue tie. There could be tethered tissues. The tongue is attached to the floor of the mouth, not able to reach the roof of the mouth. They're not able to get that backward, the posterior passage open to get the airflow in. So that's when orthodontics come into play. That's when we come in and we're able to expand the airways, expand the jaws so that we get enough space for the tongue to rest. And then comes myofunctional therapy.
Okay, so that's totally what's next for us.
Yes.
Because we've already done the tongue tie, the lip tie, the allergist, the nose spray.
Expansion.
And so then we see somebody like you.
Yes.
Got
so
it.
you see, we get the expansion done. We want to make sure, again, same point, going back, before the plates have fused, we want to get the sutures to open up to get that upper jaw. So the upper jaw stops expanding naturally by age 10. So we got to get in and get all that going before age 10, ideally.
You're so on top of it, Steve.
Well, listen, and a
You
shout
are.
out to all the parents out there who have to thread that expander. That device that you have to use to turn that, the position by which my son would like hang his head off the back of the bed so I can get in there with like my 51-year-old eye. I mean, it's the equivalent of a safety pin in a hole. And then you've got to like crank it by hand every night for like 28 nights. When I was a kid and I had do they still do night guards? Is that a thing? Or a night brace? I mean, this thing was like a full, I looked like a robot. Like there was a full wire outside of the mouth and then an elastic band. Yeah. And my philosophy was, I don't ever have to wear this, but the night before I go back to the orthodontist, I've got to set it on like the maximum so I can make up for all of the weeks of not wearing it.
It's like never flossing, and then the night before you floss like day, night.
Do they still use night guards or whatever they're called?
Headgear.
Headgear, that's what it is. Yes, headgear.
So no, and I believe
kind of barbaric.
It is, and I feel like we shouldn't be using headgears because we're pushing everything back.
Yeah.
Now we do use reverse headgear, which is when we bring the jaw forward. Okay. So that's something that still goes outside.
Like an underbite?
Yes, for underbites, but also like when you're seeing like, okay, if my child's like developing very small jaws and I just don't want to grow them this way, like transversely, I want to bring them forward as well. That's when the reverse headgear, or we call it face mask, that comes in play. So we use that along with expanders to grow the jaw in every dimension, basically. So yeah.
And it's for breathing, but this is, I guess braces in and of themselves are an aesthetic treatment. Is that accurate to say? Like, because they say you want like your chin and your nose to like end at the same place. Is this aesthetic for kids?
So, right, whatever we're talking about right now, this is purely growth and development.
Okay.
This is not aesthetic at this point. So honestly, when
that's phase 2.
Correct. Okay. That is phase 2.
Got it.
So when we're focusing on phase 1, we're just purely focusing on jaw growth, development, making sure that we get, because otherwise there's no way for us. We can't grow the jaws other than surgery later on.
And the reason being so they can sleep. Right?
One of the reasons.
What are the main reasons? So if somebody's kind of like, this is just sounding like a lot of extras.
Well, hopefully it's reducing phase 2, right? Correct. I mean, the more space I create in phase 1, the more I line things up in phase 1, then ideally, I suppose your teeth are going to come in where they belong, and then there's minimal tweaking to do on the back end.
Absolutely. That's another reason. So there's multiple reasons we're doing this. We're getting into this preventative thing again. Because one, when the teeth naturally come in a good spot, so right now we're like, hey, we have a lot of baby teeth. Why do we have all of this? But what we're doing is the baby teeth need to have enough spaces between them for the adult teeth to be accommodated in that jaw. But if the jaw, we're increasing the land area basically, right? So we're increasing the jaw sizes so the teeth naturally can self-align and come in the correct position in the middle of the bone where they're supposed to go, because then you have less periodontal issues. When they come in outside of the bone because they were crooked, they're going to come in. It's not that every tooth is going to get blocked out because there's lack of space. They're going to make their way. They will come in. They're going to come in crooked. They're going to come in high up as canine. We used to have see kids with a lot of high canines and stuff. And then what happens is, yes, with braces, we can fix it. Absolutely. That's a fixer approach. We can do the braces, bring the teeth down, but they are not going to come down with the good amount of bone or good amount of gums with it. So if overall health is needed, we need to start a little early. It's an interceptive orthodontics. You see an issue happening and developing, you kind of get in and get that corrected. So it's very customized approach. It's not one thing fits all. So it's not like every kid walking in the office has to have an expander, but expansion can solve a lot of issues, including breathing, sleeping issues, bedwetting is a big one. So that we have substantial research behind this. Like there are some kids who actually are bedwetting even while they're older, like 5-6-year-old, and they're still wetting the bed at night. Sometimes it is related to airway constriction. And then you do an expansion and there's an absolute research available that you do the expansion, kids have stopped bedwetting, Yeah.
One of the things that I think also bears saying is that I think that's why it's so important to have a good relationship with your pediatric dentist, because for us, I mean, it sounds like we're really on top of it. I'm not on top of anything. Dr. Ray, our dentist, she's on top of it. And I think I mentioned maybe once,
said it.
A lot of his friends are getting braces. And she was like, okay, it's time for you guys to go. Like, here's the referral, get yourself over there. And I trust her implicitly. So we went because she told us to, right?
What do you say to the person who's like, yeah, okay, I'm hearing you tell me that there's an option to do one, which is corrected at the end, or there's an option to do this for years on end. I'm just going to kind of roll the dice and just do it when they're older.
Yeah, I mean, I get asked this question a lot. A lot of parents just like this are like, okay, why should we do this? What happens if I wait? Will it stop me from having braces for my kid? No, the braces will still be needed, but that'll, again, same thing. The process will become much easier, much simpler, much faster. There won't be much issues. We've possibly already corrected the jaw issues and size and, all of that stuff. But I usually tell them, okay, if you're like, hey, I know that I'm going to develop heart disease. I'm going to just like let it happen. Like I'm not going to do anything to like,
well, but just like, I'm going to do it all at once when they're older.
Yeah, I'll just like do a bypass at the end.
But she's saying like at that point you might need like
a bypass. I'm asking because like I know 100% certainty. There's tons of people that are asking that.
Yeah, no, for sure.
And so I want to know like what's the argument
Absolutely.
against it?
Like again, my same thing is like it's interceptive where your child will still need braces. Yes, but at the end of the day, can we fix it cosmetically? We'll be able to fix it. If they wear rubber band, again, a roll of dice, we'll fix the bite too if they wear rubber bands really well. But then the question is, are you going to let that all happen? Like make sure you can see the things and issues developing, getting worse over time. So we're just going to let it wait and we're just going to, so again, no prevention, no getting them corrected and everything. And then there's a chance we may be like, okay, there's too crowded. We can't grow the jaws at later stage. So now we're like pulling 4 teeth out. That's
so
the
not being
approach.
able to grow the jaw.
Correct.
Is like the reason why you would like
step in early. You're making room.
Step in early, making room. Because I'm still like, okay, unless there's that, I still see a lot of people being like, yeah, have your awkward phase.
Yeah.
Well, but like think of it as like, oh, hey, I'm going to eat whatever the heck I want because eventually I'll just go on a diet. Like, why don't you just have maybe one cupcake and not become obese and then have to undo all of that at a well, but you know what? So is an expander. Trust me, that needle, I'm not kidding. That's a small
I'm glad that you are an orthodontist now though. So this works out well for our friendship.
Are there any, it seems today, and I understand that we live in a kind of a more aesthetic, cosmetic focused place, but I kind of feel like there's no kid who's not going to need braces at some point. Or are there those unicorns out there?
There are those unicorns. I'll tell you that. Like one is, I've always like made this, because people come to me all the time. Like, why do we even need braces? Like, what if we don't get braces? Nobody has died of crooked teeth. Let's just settle that argument. So
Thank you.
So it's totally fine. If you've got great confidence and you've got crooked teeth and you're like living your life perfectly the way you want, absolutely you can continue in that position and be absolutely okay. I feel like it's more of a need than a want when it comes to aesthetics of braces. And we treat a lot of adult patients, and I feel like sometimes their main reason for getting braces at 30, 40, 50, I'm putting braces on a 70-year-old is I'm not happy when I smile. Mm-hmm. Like I don't want to see myself in photos or videos. I don't want to take pictures with my grandkids, So again, yes, absolutely. Braces are not a mandatory yet, like thing that you really need to do. We're living in a kind of society that people are judged by looks and appearances. Let's just be honest on that as well. So yes, I think I get a lot of 30, 40-year-olds who are getting into the work field and they want to straighten up their smile and get beautiful teeth because the confidence that they're going to get, because they're like, hey, I'm going to go interview at places and I want to stand out as a candidate. So that's one reason, another reason that people do get braces as well. But then to answer your first question, yes, sometimes when we do really good, I know my phase 1 treatment has worked really well. When I really have to find a very convincing reason to tell the parents to get braces in phase 2.
Well, the other difficult, I have a friend of mine he's probably around my age within 10 years. So he's an adult and he has braces, not Invisalign, but full on like metal rubber bands, the whole thing. And frankly, I think that is really uncomfortable as an adult to.
You're calling him metal mouth.
Well, I mean, I'm not, but I mean, I think that. To your point, listen, for better or for worse, we live in a society where people are judged in the first 10 seconds of meeting them, right? So when I think a lot of people, they think, gosh, I'm an adult with braces. Someone's going to look at me and think, this person makes poor choices. They don't keep up with themselves. They don't care about them health. They put things off all of these things, which may not be true at all. I mean, who knows why you didn't have braces at 7? But the point being, particularly when you talk about the health, the sleeping, the misdiagnosed ADHD and all of that other kind of stuff. I would say at least the step 1 part, go ahead and check that out.
Absolutely. I mean, for that reason, for a lot of adult patients, we actually have a very unique option. We do a lot of lingual braces. So the braces that go behind the teeth. So a lot of professionals, I have patients who are in different kind of fields in front of the cameras, videos, everything, and they want to straighten the teeth. we can do that. Because, aligners, clear aligners, Invisalign came in. It's a big thing. A lot of people can use it, and it's great for a lot of people. But some people can't keep up with something removable. It's hard to have something that you have to constantly take in and out of, even before you have to take a sip of coffee. So absolutely, there are a lot of different options.
On the back, huh?
Yes.
That's crazy.
Like inside of the teeth, we have braces that go in, and they're actually super cool. It's like we've always, by the way, this is not super new as a technology. Like lingual braces have been around for years, but they were a pain for everybody, for even the orthodontist and the patients and the technicians who are working on the patients. Like you have to bend your back, work on the back, and all of that stuff. But now the technology, like the one advantage that has happened is like we're using these specialized wires with these lingual braces that have all the programs, like movements programmed in them, and we place them. The teeth move really nicely, really fast, very efficiently. There are just 2 wires you switch out. Pretty much like if there's minor crowding, you're kind of done in like 6 to 8 months.
Wow.
And that's easy. Like most of the people who've had braces as a kid didn't wear retainers and have now back to crooked teeth and want to get that fixed, it's a great option for those people.
Interesting. Okay.
Does insurance ever cover any of this?
So insurance will cover orthodontic benefit if you have that as a benefit. Like they don't really care what you're using for it. Like there are sometimes, if you're in network, out of network, all of that little logistics of the things. But yes, most dental plans, if you have orthodontic benefits, that goes towards, that's like a discount coupon, like $2,000, $1,500 towards it. So here is it. That's the money that you can use towards orthodontics.
That was our experience. So I think we had, it was maybe a $2,000 maximum benefit. And I said, okay, great. That almost covers the expander, or about covers it. But then I called our dental insurance provider and I said, hey, when I know he's about to get braces, is there an option for me to purchase a supplemental that's perhaps cheaper than the value of the supplemental, knowing that I'm going to have $6,000 in orthodonture expenses that year? And she said, yeah, you can totally do that. So it's much like you can jostle around your health insurance. There are some options there. So you should reach out to your provider. Okay. If people want to reach out to you, where do they find you?
So my practice is called Define Orthodontics. We've got 2 locations. We are in Highland Park and Snyder Plaza, very convenient for a lot of people. And then we are in Las Colinas, which is Irving, North Irving. So we're right there. The 2 locations, and Define Orthodontics, is our website. You can reach there. Instagram, we're on Instagram. We're everywhere.
Perfect.
So you just call our office, schedule a consult. We've got people working round the clock to help you. And then, we're happy to take care of everything.
Well, we're certainly glad you were here today. We appreciate all of your time and expertise. I have to say, one of the nice things about like the kids these days is I think that all of them just kind of accept this as a rite of passage. So I think the stigma going along with, like, Jacob was so excited to get his
cool
expander.
Now. Yeah, it's definitely cool.
Was so excited about it. Now, the first night after he had it on, it was, that the first 24 hours were rough. I'm not going to lie. But now, I mean, it's, and even the kids that have like a full on mouth of braces, they're like, But I'll tell you what, I was working cafeteria duty yesterday.
Tell me more.
Those 4th graders have some nice teeth.
That's why I said
these
they don't
kids
have awkward
like
faces anymore.
Supermodel teeth.
They know how to do makeup. It's true. They know how to do hair.
I don't disagree. Between the Sephora and the braces, these kids have it made.
Yeah.
All right. Hey, listen.
We
appreciate you again. We'll post the information in the description of the episode as well. We do want to remind you we have a new episode every Tuesday morning that drops on your favorite podcast platform. Go ahead and click like and subscribe so we can continue to bring all of the information that we love to do. And if you do nothing else today, go find yourself a friend you don't need to clean the house for. We'll see you next time.